Hello, hello. It's still loading. Sorry, it's still loading. My phone. That's the only thing. It's slow. It's still telling. Yeah, it's okay. Hello. Welcome. I'm sorry about what happened. Internet problems. Sorry about that. No problem. We are going to start. We are going to talk today. We are going to get there for sure. For sure. Yeah. Welcome. Once again, you're all welcome to Dr. Feel Good Inside Out Talk Time. You're all welcome to Dr. Feel Good Inside Out Talk Time. Just relax and let's enjoy ourselves. This is another Saturday. Another Saturday. Sorry about that. I'm sorry about that. I'm sorry. Yeah. Yes, so Rachel. I hope. I'm sorry, it's internet problem. It's not me. Let's just enjoy this music. Let's enjoy this one. Sweet Jesus, yes, I've danced into your tune. For as a deep into water, my soul longs for you. Forever and ever, yes, my heart beats for you. For as a deep into water, my soul longs for you. Forever and ever, yes, my heart beats for you. Something more than gold. I've got something more than gold. Something more than gold. I've got something more than gold. Inside out talk time. All I've got is Jesus. Always a pleasure to have you here on Saturday. I'm trying to Jesus is more than gold. More than gold. We are going to talk about a very important topic. I've got something more than gold. I'm telling you. Invite your friends, tell your friends. Don't feel good inside out is life. That's what we're going to do. I've got something more than gold. I'm telling to the world. Jesus is more than gold. It's such an honor that you call me your own. Your love is unchangeable, keeps coming after me. Shepherd of my heart, I love how you love me. Yeah. Treasure of my soul, I stand in awe of you. As a kid that's for water, so my soul longs for you. Forever and ever, yes, my heart beats for you. As the deep that's for water, so my soul longs for you, Jesus. Forever and ever, yes, my heart beats for you. Something more than gold, I've got something more than silver. Something more than life, I've got something more than riches. If all I've got is Jesus, I've got something more than gold. I'll tell it to the world, Jesus is more than gold. More than gold, more than gold. I've got something more than gold. More than gold, more than gold. Jesus is more than gold. Something more than gold. Something more than silver. The Spirit of the Lord within me is something more than gold. Something more than gold. Something more than silver. The Spirit of the Lord within me is something more than gold. More than gold, more than gold. I've got something more than gold. Tell it to the world. Jesus is more than gold. More than gold, more than gold. I've got something more than gold. My brother, my sister, Jesus is more than gold. More than riches, you are everything to me. Oh God, more than life, Jesus is more than gold. Oh Lord, wow. Glory to God. Hello, you all welcome to Dr. Feel Good Inside Our Talk Time. I'm glad to have you here. I'm glad to have all of you today. Once again, it's another Saturday where we meet, we have fun, we relax, we enjoy ourselves. You know, we just try feeling good inside and outside. So you're welcome. And remember, feel good inside out, bringing out the best version of you. I'm here to help you bring out the best version of you. Whatever it is, just relax, and let's enjoy our Saturday. Let's enjoy our Saturday. I want you to like, to comment, to share. We're going to talk today about fibroids. Fibroids, yes, fibroids. A lot of people have been writing to me. You know, they want to know a bit more. The basics, you know, we are not going deep. Deep is left for the professionals. We are going to talk what the common man needs to know about fibroids. So you're all welcome. Invite your friends and tell them Dr. Feel Good Inside Out is live. They should join us and let's start the program. I'm sorry for the internet mess up, but that's no problem. We have to keep going. We have to keep going. Yeah, so today we're going to talk about fibroids. And what are fibroids? What are fibroids? Some people call it myomas. En français, on appelle ça les fibromes. Aujourd'hui, on va parler des fibromes. Soyez la bienvenue à Dr. Feel Good Inside Out Talk Time. Et aujourd'hui, on va parler de la fibrome, ou myome, comme on dit. Qu'est-ce que c'est le fibrome? Le fibrome, c'est la croissance abnormale de certains tissus au niveau de l'utérus. L'utérus, c'est là où porte le bébé. C'est ça. Et ce tissu est fait à base de muscles et d'autres tissus. Et ça fait ce qu'on appelle une tumeur bénigne. Donc, ce n'est pas cancer. C'est juste une croissance abnormale des cellules aussi qui arrive là-bas. So what is fibroids? Let's define it. Let's define fibroids. You know, fibroids is a abnormal growth, abnormal growth of tissues inside in the uterus. It can be inside, it can be on top, it can be in the submucous, it can be anywhere. But this abnormal tissue is mostly made of muscles and some other tissues, And it can be simple, it can be just one, single, or there can be multiple, so many of them. So it's not just a single thing. You can have single fibroids, you can have multiple fibroids. And it's very, very common in women. In fact, it's noted that women after the 35 years run a higher risk of developing these fibroids. And that 80% of women before they end their life here on earth would have had fibroid at one moment or another in their life. So you see, something really serious. It's something really serious. And that's why we're talking about it today, because it's so much pain and worry to a lot of women. Some don't know what to do. What do we have to do? Do we have to go take it off? What are we going to do? So today we are going to talk about some possible causes. There are not too many. There are not too many, but at least it's good to know. It's good to know, because when you know these possible causes, then it's easier for you to handle it. It's easier for you to handle it. Yeah. So let's keep going. Let's keep going. Let's keep going. As I said, there are some factors that are predisposing for people to have this fibroid. Are you there? Are you there? Please, can I see your comments? Can I see your comments? Can you just comment and let Dr. Feel Good Inside Out know you are here? Can I come? Can you just comment? Can you comment? What are the possible causes? Now we're talking about possible causes. Remember, as I said, all this is found in your uterus. Growth is a growth that is found in your uterus. We call it fibroid or myomas. And this growth can either be single or multiple, I mean many of them. It all depends. It can be this small, like a small grain, just like I can get up to 2 centimeters, of size. It can be anything. And that what matters is to know what can cause it and what are the symptoms that you have, when you have this thing. Remember the way your uterus is, your womb, as people call it. You have it, and they have the mucous membrane inside. These fibroids can be directly under the mucous membrane under. They can be inside the muscles of the uterus, or they can be on top. Depending on where they are. Rachel, I'm happy you are there. I'm happy you are there. You're watching. Thanks for watching. You're always there. Thank you. Thanks for the support. Like, share, and get people to know your doctor feel good inside out is there right now. So, depending on where the fibroid is located, will depend what type, will tell you what type of symptoms you can have. Now, imagine if it's inside the uterus, inside. The fibroid now increases the surface area of the mucous membrane, inside the uterus. I don't know how to explain it simpler than this. Every organ has got a membrane inside, like a covering inside. And this covering in the uterus, in the internal part of the uterus, which we call the endometrium, it has too many blood vessels, because when fertilization takes place, the egg comes and implants bed inside. And when it implants inside, it's being fed by the blood, all the blood, that vessels and that's circulating around there. So it means if you have a growth in that place under that membrane, or where that the mucous membrane is, there's high risk of you bleeding abundantly. So you have heavy bleedings during your menses, and you can even bleed in lumps, because the bleeding is so much. What happens during some people don't even understand what happens during menstruation. During menstruation, because your body has prepared your uterus to await a fertilized ovum, that's egg, coming to implant to make a baby. Now, when there's no fertilization that takes place, the egg comes in and it cannot implant, because it's like useless. No fertilization take place, so the egg has to drop. And when that happens, it means all the blood has been accumulating there, waiting for food, waiting for preparing food for this new egg that has been fertilized, has to shed off. And that's what sheds off every month, like menstruation. Are you getting me? Are you getting me? Are you getting me? Are you getting me? Yeah. So now, what happens if the fibroid is found under that membrane? Then you have to bleed heavily. If the fibroid is found inside the muscles of the uterus, then you may not even bleed much. You have your normal regular menses, because it's not affecting the inside membrane. And at times you will not even have pain you know and better again, or somehow, when the thing is coming back from outside, when it's hanging back outside, it doesn't affect your bleeding. But the risk is that it can hang outside and compress something. It can compress a nerve, it can compress another organ, it can compress even your tubes, it can compress wherever. I hope people are understanding. I hope people are getting my point. So most often, these fibroids, they don't have any symptom. It's not painful. So the pain depends on where it's located, and if it's compressing something or not, or not. So, and the pain is very common with those that are really big. When they are big, then they can start compressing. If it's inside, you can see push the wall, and see compress some nerves and all this things, see compressing, and you still feel pains. Yeah. Now, you can also have constipation, all because of compression. Remember, where your uterus is found, there are other things. There's the rectum, the colon, and the terminal colon, and the rectum is right there in front. You have even your bladder too, right in front. You have other things around there. There are muscles, there are nerves, there are everything around there. So when it starts compressing now, when it starts compressing, then when it starts compressing, then you realize now that you start having all these symptoms that I'm talking about. Yes. And most often, when you bleed really much, what happens? Over time, you develop chronic anemia. You start bleeding too much, you lost a lot of blood, and you become anemic. You feel weak, you feel tired. At times, you feel breathless, as if you cannot breathe very well, because, of course, enough oxygen is not circulating around your body. So that becomes a problem. And it depending also on where the fibroid is located, you can have problems with conception. So it can be difficult to get pregnant. Imagine a fibroid that is found towards the side where your tubes are. Your uterus is like this, as I said, and you have one tube coming out here and one tube coming out here. So imagine that the fibroid is around here where this tube is coming out. Of course, it can block the passage of that tube. And when it blocks the passage, the egg that has been fertilized, that came out from the ovary, cannot pass and enter inside this uterus. Are you getting me? Are you getting me? Put some thumbs up, some like, and share, and share, and share, and share. Yeah, so that you understand, you understand. And now, at times, the fibroid can find itself in a position where the baby comes and implants, the egg comes and implants just near like that. And what happens over time, you likely have a miscarriage because the fibroid will start compressing that egg, that fertilized egg, the future baby, the embryo. It can start compressing it, and you'll be forced to lose that baby. That's what we say. We have fibroids. There is high chances of having miscarriages too if the fibroid is quite big. There's high chance of pain, lower back pain. Lower back pain. So those are some of the things that happen when you are having this problem of fibroid. If you are just joining us, welcome once again. This is Dr. Feel Good Inside Out Talk Time. Always bringing something good for you, something that will help edify you. At least you should know how your body functions. And that's what I'm doing here. Dr. Feel Good Inside Out. Feel Good Inside Out, bringing out the best version of you. And today we're talking health. We're talking about fibroids. So you're welcome. You're welcome once again. So now let's look at some of the possible causes. What are some of these things that can cause a woman to start developing this growth called fibroids? As I said earlier, your body secretes hormones. The main hormone of a woman is called estrogen. And then you have a fertility hormone called progesterone. So we have estrogen and we've had progesterone. Now, estrogen is the main hormone of a woman. We develop breasts, we develop buttocks, we develop small voice, because we secrete estrogen. Men, they do secrete testosterone. That's why they have heavy voice, they have beard, is a hormone that makes them be a man. Our own hormone that makes us be women is estrogen. But now, if that estrogen, you have something coming from outside that provokes your body to secrete more of the estrogen, or from outside, you take substances that looks like that hormone estrogen, of course, what happens is going to disrupt your natural hormonal system. It's going to disrupt your natural hormonal system, and it's going to cause you a lot of problems. A lot of problems. So anything that stimulates the production of estrogen is not good. And when we talk about anything, we really mean anything. So you get to know some of them here, and it's very important. All what I'm giving you is scientifically proven. Is that these are all researches carried out, because people are curious to know what is causing these fibroids, what causes it. And a lot of studies have been carried out, and this is what they are saying. That's one of the things they are saying. Yeah. Thanks, Vivian. Thanks for joining. Thanks for joining. My name. Oh, my boy. Thanks for joining, son. Taju, thank you for joining. Rachel, you're welcome. Thanks for joining. Invite friends. Share with your team, with your group. Share to your group. Somebody may learn something today. You may impact somebody's life today with the knowledge you're going to gather here today. So I'm happy to have you all again. Once again, you're all welcome to this talk time. And another thing is, when we're in medical school, they say fibroids usually occur for women who are above 35 years. But surprisingly, today we have young girls, even of 20 years, who already develop fibroids. So that's why there is a problem. And something is happening. There's something that triggers the growth of this fibroid. Something triggers it. And what are some of these things that will trigger it, that will provoke it to start? That's it. What are some of these things? I've said there's also drinking a lot of alcohol, especially beer. So studies have shown that women who drink a lot of beer, they have higher chances of developing fibroids. So if you're watching me and you're somebody who loves beer and you love alcohol too much, can you please reduce your intake of alcohol? Just reduce it, reduce it. It's for your own good, it's for your good. And if you want to stay healthy and stay strong, it's for your good. You need to reduce it, reduce it, reduce it, reduce it. And then studies have also shown that women who don't have many children, that's who have just one or two children, have a higher risk of developing fibroids. But we're not asking women to go and deliver 7, 10 children. But that's it. That's it. That's the truth. So if you find women who have delivered more children, they have lower risk of developing this growth, these fibroids. And also, if you don't eat, if you're a woman, you don't eat enough fruits and vegetables. Remember, fruits and vegetables contains what we call in medicine antioxidants or antioxidants, as some people call it. And this helps to cleanse your body of what we call the free radicals. So the toxins, some of those things that will go and disrupt the normal functioning of your body's organs, because when you take something that comes and gets into competition with your natural hormonal system, of course it disrupts the way that your hormones are being secreted. And when you realize, you start secreting so much of estrogen, and you start developing these huge, huge, huge fibroids. Studies also show this one sounds so interesting. This children who have problems of early puberty, children start menstruating before the 11 years of age, have been shown that at the older age, by the time they start getting to certain age, they start developing fibroids. So they develop fibroids earlier than girls who started menstruating at 13, 14. These are all studies. These are all studies. Are you getting me? Are we together? Are we there? I'm not seeing your comments. I'm not seeing your comments. I'm not seeing your comments. Yeah, 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 yeah. Yes. Another thing that can cause it is the lack of vitamin D. Lack of vitamin D. So vitamin D deficiency. Vitamin D is a vitamin that you get from sunlight. And that vitamin, when you get it from sunlight, it enters your body through your skin. And it improves now the absorption of calcium in your intestines, in your gut. When this vitamin is lacking, it means the absorption of calcium too will drop. And calcium is a mineral that is used by muscles. So when there's lack of this calcium, there's high risk of you developing fibroids. Are you seeing some simple things? Very simple things, but that can cause atrocities in your life, in your health. Then there's also stress. Oh, major stress. Stress can cause total confusion in your hormonal system. Think, for example, a woman who lost a child or who lost a husband or a close person. At times they will tell you that I stayed after I lost my husband, I stayed for 6 months, 8 months, 1 year without menstruation. What happened? It's just because of the stress. The stress went and caused, this disorder in her body, and she stayed like that. You lost, or any stress that is very, major stress, some of those sort of stress, that things that really shock you, that you feel it so much. If you are not careful, it disrupts your natural hormonal system, and so you start secreting too much of estrogen, and you may develop fibroid. Exposure to childhood abuse. Ha. When I saw this one, I was like, what? So at times when you treat children, we've talked about child abuse. Okay, the last Saturday program we had with Coach K, we're talking about child abuse. And now studies have shown now that when a child is abused, you know, constantly being abused, it works on their psychology. And when they realize at a certain age, they start having problems with their hormonal system. And these children tend to develop fibroids earlier. Little things, but that matters. Little things that matters. Very, very, very important. Very, very important. Yes. Another thing is the use of hair relaxers. Rachel, are you hearing this one? Vivian, all of you are you getting this point? Hair relaxers. When I look at my hair, I need to relax it soon because it's already very high. The hair is already. But thinking that inside the hair relaxer, there's a certain chemical which they call phthalates. And this phthalates, they say, tends to go and provoke the secretion of more estrogen in your system, meaning increasing the risk of you developing fibroids. So it's advisable not to retouch your hair all the time. I'm fond of doing it every 6 weeks. I do it every 6 weeks. I retouch because my hair grows so fast. So I need to be retouching it so that I can put comb in it and comb it easily. Are you people getting me? Yes. So Rachel, say I hear you. Yes, Rachel, I'm glad you are there. You are there. I'm glad you are there. Sorry for what happened in the beginning. Yes, and then you also have the genetic relation. There's some family where fibroids, like every girl in that family develop fibroids. That's genetical. And it showed that 60% of African women, as compared to 40% of Caucasian, after 35 years of age, will develop fibroid. Especially women who have not had babies before, or women who have had just one or two, then they develop these fibroids. Are you getting my point? Are you getting me? So stress was the one that I'm like, we can handle stress. We talked about stress the other week. And when you can handle stress, then it makes things much easier for you. Because remember, when I talked about stress, I told you stress will affect every organ in your body, from your brain to your eyes, to your lungs, to your heart, to your kidneys, to your liver. Every single organ in your body is affected by major stresses. And one of it now is fibroids. It's fibroids. It's fibroid. It's fibroid. Yes, it's fibroid. So I hope you're getting all these points. It's very important. You need to take it because now we are going to go to the next part of it now, where we are going to talk about how to prevent some of these things, how to prevent it. But those of you who are just joining now, you're welcome. This is Dr. Feelgood Inside Out Talk Time, always with something so good, so important to each and every one of you, because Feel Good Inside Out, bringing now the best version of you. And one of the things, since last week we started talking about health, we're talking health this morning, Feel Good Inside Out, and today we're talking about fibroids. Donc bonjour à tout le monde, bonjour ceux qui viennent de nous joindre ici, c'est encore Dr. Feel Good Inside Out, et aujourd'hui on parle des fibromes. J'étais en train de donner la liste de quelques causes. Tu vois, les causes ne sont pas bien connues, mais aujourd'hui, parce qu'à l'époque, c'était connu qu'il faut avoir 35 ans et plus pour avoir les fibromes. Mais aujourd'hui, on trouve même les petites filles de 20 ans qui ont les fibromes. Donc, ça veut dire qu'il y a des facteurs tout autour de nous qui peuvent provoquer ça. Et l'un des facteurs, c'est toute chose qui stimule la production d'oestrogène, qui est l'hormone de la femme. Donc, quand cet hormone est stimulé, ça provoque les fibres utérines de se multiplier. D'accord? Oui. Et on a vu que les femmes aussi qui ont moins de 2 enfants, 1 à 2 enfants, ils ont plus grande chance, malchance d'avoir les fibromes qu'une femme qui a accouché beaucoup. Et les femmes qui boivent aussi beaucoup la bière, l'alcool, quand tu bois beaucoup d'alcool, il y a aussi une forte chance de développer les fibromes. Les filles qui commencent à menstruer très jeunes, avant 11 ans, on trouve qu'à la longue, c'est eux qui développent plus vite le fibrome que les autres. Et puis aussi, la déficience de la vitamine D. La vitamine D, c'est cette hormone qui vient du soleil. Tu vois, et ça pénètre notre peau et ça part dans notre organisme et ça facilite l'absorption du calcium au niveau de nos intestins. Maintenant, il faut ça parce que quand il y a la déficience de cette vitamine D, il y a une tendance à développer les fibromes. On a aussi parlé des violences chez l'enfant. Quand l'enfant est traumatisé psychologiquement, ça amène un désordre dans son système hormonal. Et puis, il y a les stress majeurs. Les stress majeurs. Une femme qui perd son enfant ou perd son mari ou bien rompt une relation qu'elle était trop attachée, tu vois, avec tout ça maintenant, ça la dérange et elle commence maintenant à avoir un cycle irrégulier. Et avant de regarder, maintenant, elle commence à développer les fibromes. Et donc, tout ça, c'est des choses qui arrivent quand quelqu'un ne se prend pas soin de certaines de ces choses. On ne peut pas changer, tu ne peux pas déterminer quand
ta fille ou toi, tu vas voir ton premier menstru, tu ne peux pas savoir ce qui peut t'arriver pendant la période prénatale. Quand tu es grosse, il y a certaines choses qui peuvent t'arriver et que mais après l'accouchement, maintenant, tu commences à développer le fibrome. Il y a d'autres gens que quand ils ont le fibrome et puis la grossesse et le fibrome, ça augmente de volume. Et puis maintenant, au fur et à mesure que la grossesse grandit, lui, il peut commencer à diminuer. Parce que maintenant, tu produis beaucoup plus progestérone, d'autres hormones. Donc, c'est un peu ça, voilà ce qui arrive. Ce qui arrive. Donc, once again, you are all welcome to Dr. Feel Good Inside Out Talk Time. Welcome, welcome. Feel Good Inside Out, bringing now the best version of you. Today we're talking about fibroids. We're talking about fibroids, women, invite your friends, share with your women group, share with people, at least inform somebody about this. It's very, very important. It's very, very important. So far, we've been talking in the first part of this video, we've been talking about trying to define the fibroid and what are some of the possible causes, you know. Yes, knowing a bit what happens today and what is the problem right now, and we've explained all these things. Now we're going to see what do you do to prevent it. Now let's talk about prevention. Welcome. I'm glad to see you, Pablo, my friend. Wow, you're welcome, Kathy. Nice to have you here. Yes, yes, yes. It's always a pleasure having you. I have some faithful followers who are always here on Saturday with me. We know we need to feel good inside out. We need to feel good inside out. And this is Saturday. We want to start a week happy, smiling, dancing. That is what this program is all about. Bringing now the best version of you. Bringing now the best version of you. So, what are some of these things that we need to do to be able to prevent, you know, to prevent? First, oh, thanks for like love. Thank you so much. Wow, that's great. Wow, like love. Wow. Thank you, Pablo. Thank you so much. Thank you so much. Thank you so much. Thank you so much. Thank you all. Thank you all. Yes. So we're going to talk now on prevention. We need to know how to prevent it. Remember, I said we need to eat a lot of fruits and vegetables. So that's one way of preventing it. Eating real vegetarian per se. You know, we have to eat a lot of fruits and vegetables, all because we are looking for antioxidants. We are looking for vitamins and minerals that can help our body fight some of this disorder, that can help, you know, our body excretes, push out some of these toxins. So it's very, very important to follow some of these diets, you know. And then I talk about reducing your alcohol intake. Alcohol, the question, what is even in the alcohol that people like it so much? Women. Why? Why not? Try to limit it. It's very funny because you see at times in a house, a man is drinking, the woman is drinking, the children are all drinking, everybody is drinking. Finally, who will help who? Who is going to help the other? Who? Who? Then we need to, as we said, we need to balance this estrogen. We need to prevent it from increasing. You know, let it tighten, not go that up. And one of the things is to lose weight. You know, losing weight because fat cells tend to make more estrogen. I'm not the one saying. Studies have shown that, you know, and then studies have shown that. So we need to lose weight. We need to avoid taking chemicals that will disrupt our hormonal system. And these chemicals are found in food and in some skin products. I'm telling you, you know, in food. I won't say food is through the fertilizers, the pesticides that are being used, and then it goes into your body, it passes through the pores of your skin. So it's not necessarily what you take by mouth, you know, even through your skin. You take it, it can go and cause you problems. You have pesticides, you have dyes, you have paint. You mind that you're painting your house, and just the smell of that paint and everything can go in there and cause you problems. Yeah, it can cause you problems. And then you also have certain skincare products. Like now, I talked about hair relaxers. Most of the hair relaxers don't favor, you know, your body because there are toxins. And yet we have to use it. We have to use it because we need to look good. We need to look good, feel good, right? So we are forced to use it. And but when you are using it, no, try to take something that will cleanse, take out the toxins from you. We also have to increase our vitamin D intake. And we know vitamin D, studies have shown that can help reduce fibroids, developing by 30%. That's a lot. That's a lot. That's a lot. That's a lot. So if it means you don't need to hide, expose yourself to sunlight. If you are staying in an environment where you cannot expose yourself to sunlight, then you need to take vitamin D supplements. You need to take vitamin D supplements. You need to take vitamin D supplements. There are fortified milks and all those things that they add a bit of, these vitamins inside to let you grow. So what you eat really matters. Imagine you are somebody who likes eating chicken a lot or beef and all those things. You don't even know how they grow the chicken. You don't know how they grow the cow or whatever beef. Most of these animals, they give them hormones so that they grow big and they grow fatter. And when they take these hormones now, you go and eat that beef or that chicken, you absorb some of the hormones that they already have inside that beef, and it goes now into your body and causes problem. Are we getting you? Are you getting me? Are you getting me? Donc, c'est qu'on est en train de parler là, pour ceux qui me regardent en français, bienvenue encore sur Dr. Feel Good Inside Our Talk Time. Voilà, la deuxième partie, on a commencé par parler d'abord définir les fibromes, quelles sont les causes possibles. Bien sûr, les grandes causes ne sont pas connues, mais quelques causes sont connues. Et maintenant, on est en train de parler de la prévention, comment les prévenir. Et je dis qu'un des facteurs le plus important, c'est d'éviter ce qui stimule la sécrétion de l'ostrogène, qui est l'hormone de la femme. Parce que c'est trop les oestrogènes qui vous causent ça. Et les choses qui stimulent ça sont très souvent les choses chimiques. Chimiques. Et on peut trouver ça dans les engrais, dans la peinture, dans les pots de dans le défrisage, le pot qu'on défrise nos cheveux. Donc, il y a tout ça qui est là-bas. Et surtout que les animaux, comme le poulet, le bœuf et d'autres animaux, on les nourrit et on les injecte, on donne aussi les hormones, juste pour qu'ils deviennent gros, pour qu'on puisse nourrir la population. C'est normal. La population est en train de grandir, il faut les nourrir. Il faut les nourrir et c'est comme ça qu'on passe par là. On passe par là, on les donne ça pour qu'ils grossissent vite, pour qu'on puisse manger. Donc voilà l'une des choses aussi qu'il faut faire, il faut essayer d'éviter. Il faut aussi manger beaucoup de fruits et de légumes parce que ça apporte les vitamines et les minéraux et ce qu'on appelle en médecine qui sont souvent les antioxydants. Donc les choses que je peux appeler antitoxines qui vont aller maintenant nettoyer les toxines dans notre organisme. Ça, c'est bien. Il faut augmenter aussi la prise de la vitamine D. La vitamine D, c'est une vitamine qu'on prend du soleil, mais très souvent, on peut ne pas être là où on est exposé au soleil. Il faut prendre les compléments alimentaires. Parfois, même tu es là où tu es exposé au soleil, mais tu n'as même pas le temps pour aller au soleil là. Vous voyez un peu. Tu n'as même pas le temps et puis vous êtes en déficience parce que la vitamine D nous aide, ça nous aide à absorber le calcium, absorber le calcium. Donc, j'espère que vous êtes en train de bien comprendre ce que je suis en train de dire. Yes, I just believe you people understand what I'm saying. You understand what I'm saying. So be careful. You have to eat a lot of fiber. Thanks for liking and loving. Thanks so much. You have to eat a lot of fiber. Fiber is vegetable, fiber is fruits, eat whole grains of bread, try to eat brown rice, everything that's whole grain, beans is fine, oatmeal is fine. Then you need a lot of potassium rich foods, food which are rich in potassium, they are rich in phosphorus and are rich in magnesium. You can have all this in avocado, bananas, citrus foods, potatoes, tomatoes, all the toast is very good. It's very good because it contains these minerals that your body really needs to function well, to function at its optimal. Yes, so I hope people are getting me. What I'm saying, we need to, thanks, my dear sister Ngukwi for joining. Thanks for joining. Yeah. So you need food rich also in calcium. As I said, some of these dairy products are very good. They're rich in calcium. Cheese, milk, all these things. They're even fortified milk. That's fine. But you know what? On the other hand, also, most of these cows that are being milked, the milk is coming from cows that are being fed with hormones. So now there is some confusion. Do you really need to take the milk or not to take the milk? So that's it. And also, it's advisable to take a lot of green tea, tea that has antioxidant, and then take nutritional supplements, antioxidant nutritional supplements, because most of it's not easy to have it only on when you eat the food, right? Yes. So now, before we come to the last part of it, we are going to talk about foods to avoid. What are the things that you should avoid already? If you have the fibroid already, what is it that you need to stop taking, or take it at a lower concentration, a lower dose? You need to stop taking it. You need to stop taking it. Yes, and then we have to get on now and do some small shaking body with time. We need to do that. Yeah, I'm just getting the music. Rachel, where are you? You like dancing? Rachel, come and dance. Oh yes. Hey. Oh, 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 oh,
It's in my blood. It's in my blood. This one's in my blood. It's in my blood. Oh, put on your leg. Oh, first you never try to test it. Oh, mama, na my request. This one first. I said it on my wrist. Mama, don't give me grace. Now they run this place. See me fresh like past some Chris. I got too good in another look. Superstar, now we be number one. Number one, we gonna carry the go. Every day we rise to the top. Don't let me run it. You can't be a double leap. You go play all night. It doesn't matter who you are. It doesn't matter where you're from. If you believe, you will receive. Step bread. I got too good to never look baby. Superstar, now we be number one. Number one, we gonna carry the ball. Every day we rise to the top. Where I'm coming, baby, dollar. Where I'm coming, where I'm
Wow, 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 wow. Are we there? Are we there? We've been dancing. Rachel, I didn't see you dance. You didn't show me your signs. Jume, thanks for joining, sister. Thank you so much for joining. Thanks for joining. Thanks for joining. I hope you did enjoy the song. You enjoyed the song. You danced. Rachel, I know this is your best part. Taju, thank you so much. Taju, thanks for all the like and loves and loves and like and love and like. I love you, son. I love you. I love you. I love you. Yeah, so now let's go to the things to avoid. It's the food to avoid. You know, when you don't want to have this fibroid, it may come. This will not completely stop it from coming, from developing, but it can help. You know, and if you already have it, perhaps when you keep away from some of these things that I've said, you will feel better. Most often, these fibroids, most of them, they're not harmful. They don't even necessitate any surgery if it's not disturbing you. You know, if it's not causing you heavy bleeding or it's not that big, it's there. And most often, they say the only final solution is to remove your uterus completely. Yet you cannot remove the uterus of a woman who has not had a baby, or who has only one or two babies, who need more babies. So what happens if you even go in and do a surgery and remove the fibroids? Those are the ones that eyes can see. The very small ones that cannot be seen is still there. It always stays there. So that's it. That's what happens. So now, what are the foods to avoid? Avoid sugar. Avoid sugar, because anything that increases the blood sugar also increases the secretion of insulin, which is another hormone. This is a hormone that helps to bring down sugar level, you know, balance sugar level in your blood. And now when this hormone is very high, it means fat is deposited too much. And we said earlier that fat cells increases the secretion of this estrogen. Are people getting me? So you have to avoid all these refined carbohydrates, you know, cakes, chips, white bread, crackers, all these sodas, all these things, that flour, white flour, all these things. So it's very important to avoid most of these things. Yes, and also avoid foods that increases the estrogen, especially red meat, red meat. Soya beans too. It's also soya milk is also incriminated. You know, some milk, most of those animal milk, you know, most of the animal milks, they recommend that you take a lot of like almond milk, you know, some of this vegetable milk. You can take it, then that's fine. So avoid most of these things. Avoid this chicken that we buy. They are looking so bulky, fresh, and so on. No, no, no. They have a lot of hormones. So that one is not also good. Try to eat less of it, less of it, and then you realize that with all this you stay healthy and fine. You'll be much better. When you understand how to handle your stress, how know that you have to take there are some nutritional supplements that if you start taking it and taking it earlier, it will help to prevent, you know, your uterus from developing these fibroids. If you start taking it when you already have it, if the fibroids are not too big, it can help to either just stop it there or reduce it, you know. But when it becomes so big, surgery is the last resort. So you're all welcome again today, and I know you've understood something today. You've understood something today. Donc pour tous mes amis francophones, j'étais en train de parler maintenant. Yeah, wow. J'étais en train de parler maintenant les choses qu'il faut éviter, qui peut aider aussi pour prévenir la croissance ou bien le développement des fibromes. Et l'une des choses, c'est d'éviter le sucre raffiné, le sucre blanc, parce que le sucre fait que le taux de sucre augmente. Et quand le taux de sucre augmente dans le sang, l'insuline, qui est l'hormone qui régularise le taux de sucre dans le sang, lui aussi, il augmente. Et quand le taux d'insuline augmente, ça augmente aussi le dépôt de graisse. Donc, on prend du poids. Et on sait bien que la graisse favorise aussi la production d'oestrogènes. Donc, méfiez-vous de ça, les chips, les boissons gazeuses, comme la sucrée, quoi. C'est qu'on met le sucre dedans, c'est bien. Il faut éviter ça. Il faut éviter aussi des produits certains produits animaux. Comme je disais tout à l'heure, il y a des animaux qui sont élevés avec des hormones. On les donne les hormones pour qu'ils grossissent vite, pour que les gens puissent manger ça vite, vite, vite. La population est en train d'augmenter. Il faut nourrir la population. Donc, c'est bien, il faut nourrir la population. Il faut donner les hormones. Et puis, c'est pour ça qu'il y a un peu de confusion parce que on est en train de favoriser que boire le lait parce qu'on a besoin du calcium, les muscles ont besoin du calcium, mais de l'autre côté aussi, ça dépend de quel lait aussi que tu prends. Parce que c'est le lait de vaches, très souvent, ces vaches sont nourries avec beaucoup de hormones. Donc, quand tu prends ça, ça va maintenant déséquilibrer le fonctionnement de ton organisme, hein, le système hormonal. Ah, yes, Irene. Irene. Thanks for joining. Say good evening, doctor. I am late for the direct. No problem. You can always go back. You can always go back and replay it and watch it. Just visit my page, Feel Good Inside Out, and you can watch the video. Don't hesitate to share it with friends. These are basic information. This is not from a doctor, but it's from, it's just like what you need to know. We need to know that. We need to know. Everyone needs to know because there are a lot of people who are so worried and they don't know what is happening. Why am I developing fibroid now at this early age, or when I've been having children? Why am I developing fibroids? There are a lot of questions surrounding this fibroid thing these days, and that's why it's good for you to go back and then watch this video again, and you may be able to educate some other person. You may be able to impact somebody's life. You may be able to talk to somebody. So those of you who are joining now, we're about ending the show. And you just need to go back and watch. Donc, pour ceux qui viennent d'entrer maintenant, merci, mais il faut rentrer, regarder ces vidéos. On est en train de finir. Donc, regardez, il y a beaucoup de choses qu'on doit apprendre, surtout les jeunes filles. Il faut écouter. All these young girls, you need to watch this video. You need to watch it. I'm happy that you're always here on Saturday with me. I thank you all because, you always make my day on Saturday. I look forward to Saturday. I don't take it for granted. I thank you so, so much. You forgo everything to come and listen to me. I am so, 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 so honored. Thank you. Oh, Solomon. Thanks for joining and thanks for sharing. Taju, thanks for sharing. Metro Kuong, Patricia. Wow, thanks for joining. Mirror Radio TV. That's the CEO of Mirror Radio TV 93.7 FM. If you don't know about it, start listening to Mirror TV. And that is Metro Patricia Kuong. So much to also learn from that television station. So I thank you so much for joining. I thank you so much. I have to stop right here. But as usual, we don't just stop like that. Feel good inside out. It's all about feeling good inside out. So we need to do some small shaking, some few minutes shaking before we call it a day. Please don't go. Stay tuned. Dr. Feel Good Inside Out Talk Time. We always end with some dancing. So dance with me right now. Dance with me. We need to dance.
dancer. Sikama from Jokano call. Sibamo call. Bambakano. Baba Norga. Yenya Tamaso. Yenya Tamalara. Yenya Tamatuna. Tunu. Atama Yamana. Boyumbo Kubo Bang. Balo on Samumbo.
Thanks so much for watching Feel Good Inside Out Talk Time. Next rendezvous. See you again Saturday next week with another wonderful topic. Make sure this video you share it. Share, because this is a very, very common problem and people need to know. People need to have at least a basic information. So thanks for joining. Thank you so much. Thanks. I love you all. Metro Kwon say bless you for your love for us. I love you people so much. I just can't wait Saturdays, knowing that I'm coming to meet most of you here. I'm so happy. And I know we'll see again next week. As usual, I'm going to post the topic on my status the day before or 2 days before. I love you all. I love you all. But remember, God loves you more. Je vous aime bien. Rendez-vous samedi prochain avec notre édition live de Dr. Feel Good Inside Our Talk Time. Partagez ces vidéos. Vous pouvez partager. Ça, c'est un problème très fréquent. Partagez ces vidéos pour qu'au moins les gens ont l'information minimale. Vous voyez un peu. Donc, c'est ça. Rendez-vous samedi prochain. Merci beaucoup. Je vous aime, mais Dieu vous aime plus. Bye bye.